Dr. Hal Danzer, a reproductive endocrinologist, infertility specialist at Southern California Reproductive Center. Over the past 20 years, we've been engaged in helping individuals and couples build their family. Today we have many questions about in vitro fertilization. Why is it so popular? Why is it successful? When do you do IVF? So in vitro fertilization is really very simple. It's a matter of getting the egg in a dish and then having a sperm either injected or placed over the egg to fertilize the egg and create an embryo. Once the embryo is created, we grow the embryo for 5 to 6 days currently. How an embryo grows in the first 5 days tells us a lot about the genetics. We estimate that probably 50% of embryos stop growing before day 5 or day 6 because they're not genetically balanced. So the first test of the genetics of an embryo is how they grow. Today, on day 5 or 6, we have a 100-cell embryo. At that point, you can take individual cells, 2 or 3 from each embryo, and then freeze the embryo, send the cells to the genetics laboratory. It takes a week to get the results back. And again, depending on the woman's age, half or of embryos may be normal. Later at age 40, maybe 1 in 4. But the genetic test really tells us about the balance, and that is so important. Today, if we have a balanced embryo, all 23 chromosomes from the sperm and the egg, if they're balanced and there's no extra or missing genetic codes, the pregnancy rate to transfer one embryo is close to 80%. And that's changed dramatically over the past 10 to 15 years. The other advantage of IVF, with a genetically balanced embryo, the miscarriage rate is only very low at 7%, whereas an untested embryo with IVF in years past, the miscarriage rate was 25% because those embryos were not genetically balanced. But today, with genetic testing, we can identify those embryos that might miscarry, so we don't transfer those. One of the new technologies for IVF that we have here at SCRC is what they call an Embryoscope, where you can take, it's like time-lapse photography, it's imaging of an embryo as it grows in the first 1 to 2 days. We know that embryos that grow from 2, 4, 8 cells have much greater potential than ones that go from 1 cell to 3 cells or 5 cells to 2 cells. So it helps us rank the embryos. So we know that IVF today gives you the best chance of success, but also the quickest time to get pregnant successfully and have your family. And luckily, embryos that are frozen today maintain frozen with good potential for probably up to 10 years. So a second or even a third baby is possible with just one in vitro fertilization site.